Welcome to Prema Yoga Institute's Universal Precautions class. This class is intended to give you an overview of what you need to work in a clinical setting as a yoga therapist and handle the things you might encounter there. In addition to the universal precautions, each clinic may have its own policies to follow. This class will go over the following information: roles of the different governing bodies, universal precautions, modes of transmission, hand hygiene, glove use, cleaning, and disposal. As a yoga therapist, there are 3 organizations you might encounter regulating your work environment. OSHA is the Occupational Safety and Health Administration. It helps set the standards for care by assisting the states in providing research, education, and training in the field of health and safety. It covers most employees in the U.S., but it excludes those that are self-employed or those that have a separate regulating body, like the Coast Guard. OSHA's focus is on protecting the worker from unsafe health practices, and it covers more than just health care. CDC stands for the Center of Disease Control and Prevention. They are a federal agency that supports the health promotion, prevention, and preparedness activities in the United States with the goal of improving overall health. The CDC is a government agency who protects the public from disease and sets the standard for public health. Additionally, there's the New York State Department of Health. New York also has a Department of Health that will set additional standards and investigate work and health-related violations. You can find more information about them here. If you find yourself working in another state, you should check in with their Department of Health. What is a universal precaution? A universal precaution is an approach to infection control that focuses on blood-borne pathogens and other fluids that may have the same contagion properties. Examples of this contagion include HIV, hepatitis, staph, strep, salmonella, shingles, syphilis, TB, measles, chickenpox, herpes, and more. So, what counts as another kind of fluid? Semen, vaginal secretions, cerebrospinal fluid, synovial fluid, peritoneal fluid, amniotic fluid, saliva, and any fluid containing blood, feces, urine, or you cannot tell what it is, vomit, and in some cases, breast milk. The universal precautions are specific to fluids and objects that have come into contact with fluids. All body fluids should be treated as potentially infectious. You should use gloves and masks if coming into contact with fluids. With the population that we work with, this could be an emergency situation, such as a fall, someone becoming ill in your class, or any event that might bring you into contact with other fluids, such as saliva or breast milk in some cases. So what, then, is a standard precaution? A standard precaution represents the minimum infection prevention measures that apply to all patient care, regardless of the suspected or confirmed infection status of the patient. These practices are designed to both protect health personnel and prevent the spread of infections amongst patients. Standard precautions include hand hygiene, the use of personal protective equipment, respiratory hygiene and cough etiquette, safe injection practices, and safe handling of potentially contaminated equipment or surfaces in the patient environment. It is important to protect yourself and the clients, as infections are easily spread. Diseases may be spread through the following modes of transmission: direct, indirect, droplet, and airborne. This is by no means a full list of possible transmissions. Now let's talk about hand washing. Are you washing your hands before and after teaching? Hand washing is an essential part of keeping both you and your patient or client healthy. The CDC states that on average, healthcare providers clean their hands less than half of the time they should. On any given day, about 1 in 25 hospital patients has at least one healthcare-associated infection. Hand hygiene procedures also include the use of alcohol-based hand rubs and hand washing with soap and water. Alcohol-based hand rubs are the preferred method of decontaminating hands, except when hands are visibly soiled. Here are the sample procedures for performing a hand hygiene using alcohol-based hand rubs. Dispense the product. Apply the product to the palm of your hand. Rub the hands together, covering all the surfaces of the hands and the fingers until they are dry. No rinsing is required. If you're washing your hands with soap and water, you're going to wet the hands first with water. Then apply soap to your hands and rub your hands vigorously for at least 15 seconds. Rinse your hands with water and dry them thoroughly with a paper towel. Then take another paper towel, turn off the faucet, and open the door. This is the step we usually miss. It is also recommended to avoid jewelry and keep your nails short and trimmed. Always perform hand hygiene in the following situations. Before touching a patient, even if gloves will be worn. Before exiting the patient's care area, after touching the patient or the patient's immediate environment, after contact with blood, body fluids or excretions, or their wound dressings, if hands will be moving from one contaminated body site to a clean body site, and after glove removal. Gloves should be worn anytime you come in contact with a body fluid or to clean up a spill. They should additionally be worn if your client is immune-compromised, contagious, or your client has any sort of rash or open wound that you might come in contact with. They should not be worn with HIV and AIDS patients who do not have open wounds. Unless you are coming in contact with mucus or blood, you are at no risk. Never wash or reuse gloves. They are single-use. Change your gloves when you have touched something contaminated. When you have touched your own body, you have dropped them, or they are compromised. You may additionally use barriers of other kinds. If you or your patient has an illness, either cancel or wear a mask. Some people may be so compromised that even healthy people are at risk for harboring infection. It's best to ask them and their healthcare team what their particular risks are and what prevention should be taken. Gowns, hair covers, and glasses are commonly used barriers. Okay, let's talk about cough etiquette. All persons with signs and symptoms of a respiratory infection, including faculty and staff, are instructed to cover their mouth and nose when coughing or sneezing, dispose of used tissues in covered bins, use a surgical mask if coughing, wash hands after contact with respiratory droplets or secretions, separate by at least 3 feet of contact, and avoid contact with patients. Now let's talk about cleaning. There are 3 types of clean you need to be aware of. Regular cleaning removes visible organic residue. Disinfecting usually involves a standard cleaning product in a dissolution. You can buy an EPA product for this, or you can use alcohol, hydrogen peroxide, or a mix of 1 cup of bleach to 10 cups of water. Sterilization generally involves all of the above plus heat or chemical treatments. Vinegar, witch hazel, and essential oils are not recommended cleaners capable of disinfecting at a medical level. Yoga mats, blocks, bolsters, and straps are all excellent surfaces for a virus and pathogens to live on. If you are working in a therapy capacity, consider non-porous surfaces. Creating barriers and washable surfaces are essential. Depending on the level of precaution needed, you might consider having wipeable covers made, using pillowcases to cover items, purchasing personal straps for your patient or client, or using towels to cover the mats. Cleaning should be done on a regular schedule, and disinfecting should be done after each use. Medical waste, such as gloves, should go into a medical waste container. If no container is available, put waste in a double-bagged environment away from anything it could contaminate. Lids and seals are essential. If you're using fabric barriers for your covers, those covers should be washed each time, ideally in a bleach solution, 10% dissolution, or in a medical wash, in very hot water. In the event that you have to work with blood, spills, or vomit, you're going to follow the following. Always treat the spill as harmful. Put on gloves, block off the area, wipe up the excess with paper towels, pour bleach solution around the spill and on it. Let the solution sit for 20 minutes. Disinfect all cleaning utensils with bleach and let it air dry. Put all soiled materials into double plastic bag. Then wash your hands. You also need to dispose of gloves, masks, and spill-related items properly. All contaminated objects should be marked biohazard and put in medical waste. If none is available, mark it and double bag it. Sharps may not be disposed of in this way. Depending on where you work, there may be other procedures. This video is intended as a basic overview for working in a medical environment. Thank you for watching. Stay healthy.